There were more deaths from coronavirus reported around the country today, but still there are no cases reported in Nashville yet.
News Channel 5's Jesse Knutson sat down with world-renowned infectious disease expert Dr. William Schaffner at Vanderbilt today. And Jesse, I know he's been busy trying to educate people all around the world about this virus.
Yeah, and he was nice enough to fit us in between the BBC and an interview with the New York Times. And you know, well, Dr. Schaffner says that this is changing and there's still a lot of unknowns with this virus. It's possible it could just stay in specific cities or states and not make it here to Nashville, but it's also possible they could already be in Nashville without anybody knowing it.
I think any place in the United States could have a case that's gone undetected.
Dr. William Schaffner has been following coronavirus closely, and he said while many are afraid of the outbreak, here in Nashville, you should continue life as normal.
They shouldn't panic. There's nothing to panic about. We have lots more influenza than we do coronavirus, but it's reasonable to think, what would happen if there were coronavirus in Nashville? How would our family adjust to that?
Things like staying home from events or working from home are good options if an outbreak were to happen. But at this time, that would just be planning for the worst-case scenario. For doctors, they're not even sure the severity of coronavirus yet, and they don't have all the data they need on typical cases.
That the tendency is, of course, to pay attention to the most severe cases and to test them. So less severe cases don't get the same testing and same attention.
At this time, it's all about evaluating what risks you're willing to take, especially when it comes to things like travel.
But it all depends on your own risk tolerance. There are two considerations. What are the risk of my actually getting an infection? Still pretty low, even though you're traveling internationally. But if things get worse while you're traveling, could there be some interruption of travel and you might be stuck in that country at least for a while?
For domestic travel, again, it's way more likely that you'll get the flu at this point than coronavirus for sure. And for international travel, again, it's more likely that you'll be impacted by the reactions to the coronavirus rather than actually getting coronavirus. Live in Nashville, Jesse Knutson, News Channel 5.